Good morning to one and all. Respected Dr. Sanju, Apex Director, and guest of honor, Dr. Pari, IMA President, and Subhata, World Skill Advisor, I don't know exact designation, and my dear friend, Dr. Jainikam, Vice President of South India Tamil Trainers Association of India branch. Thank you so much for inviting me. Dr. Sanju, it has been a long association with you. I think today is materialized. And my dear beloved Florence Nightingales and the special heroes and heroines of today's awardees and doctors and ladies and gentlemen. It is indeed a great pleasure to stand in front of you on this great International Nurses Day, that is 203rd birthday of Florence Nightingale. Isn't it not a great thing that you and me are here because of that so-called Florence Nightingale, lady with the lamp, the 18th century woman who made a women entrepreneur, and I would say she's the real women empowerment woman. She made you and me to stand here in this occasion in the 21st century. She gave a big fortune for all the women. Imagine 18th century women, 19th century women will be just cooking, washing clothes in the house, and we are with the jobs now. We are independent, we are empowered. So really, I think we all have to give a big clap for ourselves for being here in this profession as a nurse, first of all. And I just completing an event in the morning, and I'm happy to share with you as a TNI, together. Today morning we did a Young World Record Achiever Award. We have done a 203 feet Rangoli art of Florence Nightingale, Lady with the Lamp, and with 203 students with 45 institutions and in 23 minutes. Morning we have got that certification from Young Achiever World Record. So it is our students who did this. So we are really molding our students in that way. One thing I really would like to appreciate with Dr. Sanju, you divided in two aspects these awards. One is clinical and leadership. You know, many at a time, nobody believes nurses have the leadership quality. They think always nurses, "Vela sonna seivanga, na sonna seiyinum," right? This is the attitude most of the health industry has. And whether invariably it may be a medical or technical people, whoever it is, but the times are changing. The times are really changing. Imagine the World War I between 1918 to 1920. There, our nurses, prior to that World War I, we are independent professional. If you want a nurse, you have to hire a nurse for you. We are an independent profession, independent entrepreneurs. You need to engage like you got a family doctor like that, you have a family nurse, family midwives. When World War I, after the world pandemic flu happened, it's all moved from home industry to the hospital industry. We really moved when World War II happened, and it is fully moved to the hospital. That is how we all moved to the hospital. We have forgotten our community much in midwifery too, right? When I'm talking here as a nurses, and I never want you to forget, every one of you is a registered nurse and registered midwife. You all proudly say, even Dr. Jainikam said, I am proud to say I am a nurse, but I would like to say, I am proud to say I am a nurse and a midwife. Okay, that is the credit of me, that I can conduct a delivery, normal delivery. That is what more important, right? Nowadays, if you see whether it is a private or a government, the cesarean sections is really peaking. Right, where if you see the western part or even in the African part, even our nearby country Nepal, the normal delivery rate is quite high because the deliveries are conducted by midwives. Right, even here it is in the hospital, we nurse midwives are conducting, but I don't know, somehow the society, or we never proclaim ourselves, like how we said, I'm proud to be a nurse. We never proclaim that we are proud to be a midwife too. I think that area, Government of India is catching up very well. Now the talk of Government India is midwifery practitioner. Maybe, I don't know how many of you that word you know, that a nurse midwifery practitioner, 18 months course, Government of India already rolled out 5 states, especially the Telangana, is the biggest success story, Telangana state. And now Tamil Nadu, we have sent from our government 6 nurses for Fernandez Hospital for training. Now we are going to implement that 18 months training at Madras Medical College. Soon we will have such thing. So every hospital you are going to have a midwifery-led care unit and obstetrician-led care unit where complicated delivery will be referred to the doctors and the normal birthing will be conducted by the nurses. So the initial assessment is fully done by a midwife. Why I am quoting this? See, every profession they say they have a independent practice and all that, but whereas the midwifery was an independent practice earlier with the nurses, but slowly it waned off. So I think we need to revive with this, and Government of India is a given beautiful scope of practice. I don't know how many of you read that. Please go and browse it. Scope of practice for independent midwifery practice. They have given beautifully. So it's time for us. Of course, we have moved to, especially in Tamil Nadu, our birth rate is really come down, 1.4 or 1.8 something. Every baby is a precious baby. So it is a society, people mind should change, that they can have a better delivery. I have seen I think 1 year back, this famous actor Nagul, his wife went and delivered with Telangana, Hyderabad, Fernandez Hospital. She was giving an interview. The delivery was conducted by a midwife. She was so caring. I had so confidence in her hand. So that state here, it has to come down. It has to be referred here. So we need to advocate along with nursing all these things also to make the visibility to nursing. Because I don't know how many of you read World Nursing Report by World Health Organization 2020. It used to be published every 10 years. So that the year it was declared as the year of the nurse and midwife, but unfortunately due to Corona, we were not able to really do it in a very grand manner. But that document speaks volumes. The first thing they say, nursing profession, to make it visible, you need to make yourself visible. So as ICN said this year, theme, our nurses, our future. Namadhu seviliyargal, namadhu edirgalam. Our nurses, our future. It says clearly, you make the invisible nurses into a invaluable, valuability. You need to bring it to with values, the nurses. That is what we are expecting you today. I am happy that with World Skills, I know as Ms. Subhada said, we just met a month before. Maybe if they would have come earlier, I would have done with my council's permission, would have rolled out in a very grand manner throughout Tamil Nadu. It was a very short time, so I didn't even accept it because I didn't have any time for that. We were already been having a lot of plans. So this time, within the short time, this 1 month, I think, 5 regions they have conducted with the clinical and the leadership skill upskilling program. I was so impressed. After you left, I went through the website and I was really, really impressed with the World Skills. I wish my Tamil Nadu nurse, okay, I'm a little, selfish. I won't say Indian in that way. I would say my Tamil Nadu nurse should get next time in 2024 at Lyon, the Best World Skills Award for nursing, helping others category. I am looking forward to work with APACS and with World Skills so that my nurses, it's not for students, it's basically for nurses. Maybe wherever this College of Nursing is attached, we can have an agreement or sort of, and we can make our nurses to participate in Lyon, that is in France, in 2024. I keep my fingers crossed and put my prayers with God. That should be a successful one. So the India should turn back and see, hey, there are quite a good nurses apart from Kerala. Okay, every time we say Kerala nurses, there is a Tamilian nurses over here do a wonderful job. Now you ask everywhere in the whole of India, the council name, they'll say Tamil Nadu is the best council, they'll say, okay. So I keep getting people from Karnataka, Odisha, and from Uttar Pradesh and from Assam, Madhya Pradesh, all are visiting our council, okay, because we have done a marvelous work over here. Talking about skills, we have developed ASCII manuals for each specialty, for fundamental of nursing, medical nursing, surgical nursing, pediatric nursing, psychiatric nursing, community nursing, and OBG nursing. For all this, we have developed a standard ASCII manual. So no college would say, hey, I have done this procedure this way. No, I have done this procedure this way. Cannot say. We have set a standard, uniform standard in Tamil Nadu, right? So that is the credit. So that gives a more of a standardizing the skills. Whatever you come up with, we are, I'm sure we are confident. and we will be achieving that competitions. Here, this is the era, as I told you, the 21st century we are moving on. I think to Dr. Pari, IMA President Janie has given a lot of what is present day nursing. I would like to say there is a nursing called nurse practitioner in critical care nursing, where nurses are allowed to do everything. Everything. I do what you know very well in the ICU. I resuscitate my patient. I take a ABG and everything. I inform you, hey doc, this is what happening. And you say, oh, Dr. Ann, you are there. And you just go ahead and you write it and you trust on us. But now we are going, the Government of India and Indian Nursing Council has made it legally to do those things. That is the plus point of this 21st century. See, when you are moving to 21st century, as Dr. Jainikam said, 1.0 era, 2.0 era, I think we are moving much forward faster with AI, right? How many of you know ChatGPT, right? Today, AI, right? Today, everybody talks about it. Is it AI going to rule us, right? But I look forward in a different way, right? See, for my nurses who are working in the neuro ICU, casualty or geriatric ward with a obese patient, and it is very difficult to move and turn around and to give the care to the patient as well as to feed the patient. Maybe an AI robot will help me out. You should know how they can just rolling out a patient, all such things with the direction of a nurse. It is quite easy. You should know all these things, and it has become a virtual reality and audio reality it is. So we are going to bridge this gap. Don't think this is going to replace us. It's going to bridge the gap between the clinical education and the practice setting, and it is a gaming like. For example, people think only simulation education. Now it's coming up in a big wave in India, and we have also started up with the council and a MOU signed up with the simulation center in Tamil Nadu. We are doing in a great way. For example, everybody thinks simulation means, oh, high fidelity mannequin. How can man says I can buy 3 crore, 4 crore mannequin? No, nothing. You just change the low fidelity environment into a high fidelity environment. Just for an example, நம்ம இன்ஜெக்ஷன் போடுறதுக்கு எப்பவுமே என்ன சொல்லுவோம், நாங்களாம் படிக்கும்போது எங்களுக்கு ஒருத்தர் வாட்டர் ஃபார் இன்ஜெக்ஷன் போட்டுப்போம், right? My teachers used to teach us. And nowadays, after that, we started putting in the mannequins. அது போட்டு அந்த இடத்துல அந்த ஹோல் மட்டும் டேர் ஆகி சீக்கிரம் போயிடும். Now they say practice with oranges. Okay, very easy. Okay, so you should know how to make low fidelity to the higher fidelity. The same way, virtual reality. There is a lot of scenarios given, because a nurse in her life, every day is not the same. You may bump around with a different type of scenarios. Maybe one day mass casualty, one day a patient come with poisoning. So something different scenarios. You have some friction with the common public, or you may see a psychiatric patient yelling at you. So different things you will face. So this virtual gaming will give you, where you just walk as a nurse yourself and it give you all the reality, which I have witnessed 5 years back itself with IIT Madras. They took me, those students, they have done this neonatal resuscitation in that way. I was telling it's going to be a real game changer. But I think now it is becoming reality with AI. I think we don't need to really make, as Dr. Jainikam said, today public are really Google generation. They will ask you 101 question, whether you are took my temperature rightly or took my BP rightly. So better we learn the situations in the simulated environment, so that you are confident to do in the reality area where with the handling with the human being, because everybody life is precious and we are fortunate to care for somebody's beloved one. That is the gift God has given to each one of us, whether invariably to a nurse or a doctor or whoever it is, and we are fortunate in this profession. And also one thing I want to tell you, the concepts are changing now. Now everybody wants short hospitalization, doesn't want a long hospitalization. They want to be cared at home. Even the geriatric population is coming up. I hope you all know, India is the second toppest country in the world in the geriatric population, right? So we need to care for them. So we need to invest on them. So how will we do? So is it possible for them, all of them, to get admitted in the hospital? Not at all. So you need to go back from the family doctor concept and the family nurse concept. Right? I want you to catch up 100 households with you. Every third, every second house with diabetes and hypertension and whatnot. Now cancer also coming up so much. So they need to give and check the BP, check the blood sugar, and you need to do the carrying. Sometime IV injection, they would have the doctor's prescription. Okay, doesn't allow no subservient role. Sir, why it was subservient earlier? Nalla thalaiyala varina and the kaalathula only nuns mattum dhaan vandanga in the profession. Christian missionaries have come. Later on, slowly everybody started coming in. Right? It's changing era. So we need to understand this. So every one of you, நான் பழைய காலத்துல சிவாஜி படம் பார்க்குற மாதிரி எங்கள் குடும்ப டாக்டரை கூப்பிட்றோம் அப்படிங்கிற மாதிரி எங்கள் குடும்ப நர்ஸை கூப்பிடணும். Yesterday, I don't know, day before yesterday, we celebrated International Nurses Day. Our Member of Parliament, Honorable Tamalachi Thangapandiyan Madam was there. She told, தமிழ் தான் சொன்னாங்க, எங்கள் ஊரில் இன்னுமே நாங்கள் இருந்த காலத்தில் midwives, போஸ்ட்மேன், இந்த டீச்சர், இந்த 3 பேருக்கும் எங்கள் குடும்பத்தில் என்ன நடக்குதுன்னு அவங்களுக்கு தெரியும். அவங்க எங்கள் குடும்பத்தில் ஒரு அங்கம் அப்படின்னா என்ன? இட்ஸ் a family nurse concept, nothing else, right? So you need to have such touch up. Don't give your opportunity to other people. Now if I see a lot of non-medical and medical people are dominating this profession of making entrepreneurship, running these businesses. But I'm happy, and few of my male nurses, I think one of the male nurses, Mr. Surendra, got award also for being an independent wound care specialist on that day before yesterday when we were awarding for a best nurse personnel. So like that, you need to think a lot of opportunity. Nobody will come and tell you. Innovation is in your hand. You can make it. Yesterday and today morning, I met one girl. She's an artist. Basically an artist. She's a MSc nurse, but she's working with some private organization. But she does art. அந்த பொண்ணு தான் எங்களுக்கு அந்த 203 feet-ஓட full diagram வரைஞ்சி கொடுத்தாங்க. That's her part-time job. See, people know how to make themselves. Don't be thinking nurse நான் அந்த 10,000 சம்பளத்திலே ஒர்க் பண்ணோம், நம்ம IMA ப்ளீஸ் அக்செப்ட் பண்ணுங்க, எங்களுக்கு கூட சம்பளம் கொடுங்க. யாரையும் கேட்க தேவையில்லை. ஜெயினி சொன்ன கான்செப்ட் எடுத்தாலும் வின் பண்ணலாம், ரைட்? தட் ஐ cannot say, right? But we have a lot of opportunity, lot of things. I would like to say here, in some of the male nurses in near Coimbatore, 3 or 4 boys, they joined together, they have started a daycare center. For example, I have my old parents at home. I want to go for a job, earn money, but nobody is there to take care at the daytime. My parents, I can leave them there with the hands of the nurses. They take care, and then evening they pick up when they go back home. So think novelly, okay? Novice ideas are invited, and you need novice ideas in your profession that will make you real great successful. So don't ever be having a tunnel vision, have a broad vision in our profession. These are all the world skills and other area, apex skill. It's giving you an opportunity to upskill and reskill you. Okay, that is a great opportunity. We are bringing you in. Utilize this opportunity and be successful and be competitive. With one word, watch. I will finish my talk. Watch, எல்லாருக்கும் தெரியும், எல்லாரும் வாட்ச் கட்டியிருக்கோம்ல, ரைட்? வாட்ச், ரைட்? இட் இஸ் வெரி இம்பார்ட்டன்ட். அந்த காலத்தில் வந்து எனக்கெல்லாம் இன்னும் வாட்ச் பார்த்தா தான் திருப்தி. ஆனால் இந்த காலத்து ஜென்ரேஷன் எல்லாம் மொபைல் ஃபோன் பார்த்தா டைம் பார்த்துக்கிறாங்கல்ல, ரைட்? தே ஆர் ஆல் ஸோ யூஸ் டு இட். பட் திஸ் ரிஸ்ட் வாட்ச் மேக்ஸ் மீ டு திங்க், be watchful what's happening around you. Okay? Then A for attitude towards your profession. How am I doing it? And actions. If your attitudes are good and your actions towards your patient care will be excellent, right? And T for transformation and technology. What is happening with the technology? You sail with the transformation, right? Then the next C for your competency skills, right? These 10 fingers. That's what Madam said. Head, heart, hands. This competency. If you sail with this technology, with this competency, then the last stage with the humanity, with empathy, no more sympathy. With empathy, you can do your humanity care to your patients so that we all as a team, it is not the successful outcome of a patient not only depends on a nurse, it is a teamwork. Now we are all come out of the physician-centric world to a patient-centric world. So as a team, we can rock together. See, now I can see doctors, nurses, and other technical people also here. So it shows a great unity with the interpersonal relationship. I was happy that one doctor jury received the best jury award. You know, I always think, I don't know how many of you know JPIGO, John Hopkins International. That's a great organization under WHO. Who is the head, you know, for JPIGO? A nurse is the head of the director for that. Under her, about more than 100 doctors are working, lot of nurses are working. I always admire that woman, you know, for her. How could she, you know, make a change? One day it should come. Such things should happen. We should have a good relationship, IPR, without any ego, without any superiority. We as a team, with the we feeling, we should work. I saw this today, Dr. Sanju, in your Apex. I hope you will keep up that and continue to make this profession to make it visible to the society and among the fraternity. Not only nursing fraternity, among our medical fraternity, among our health personnel. It is very important because we don't know, many people don't know what nurses are. இன்னும் அந்த காலத்தில் தான் இருக்கிறோம். என்ன நர்ஸ்னா, நான் சொன்னதை கேட்கணும், சொன்னதை செய்ய, ஏன் பேராசெட்டமால் கொடுத்த, ஏன் இவ்வளோ கொடுத்த, ஏன் டாக்டர் டோசேஜ் பண்ணால், ஏன் இவ்வளோ படுத்த. No. And I want to tell you, Tamil Nadu is the highest number of PhD holders in India. We have 484 PhDs in Tamil Nadu. And I'm really looking forward, the whole of India, I wish and pray, and I request every one of you to pray, there should be a separate nursing university for us so that we can show much more standards, quality standards in our nursing care to our patients. At the end, what is the outcome should be, even at the people who are at the grassroots level should be benefited. I love the quote which has been said by the former Prime Minister of our country, the great lady, Mrs. Indira Gandhi. She said in one of the TNI conference at Mumbai, she said, if the nurses are given an opportunity, not merely a subservient under the doctors, she will be a great cost-effective, care-effective caregiver at the grassroots level. This is what she said. I hope you understand, right? The nurse will be the best care-effective, cost-effective caregiver at primary care provider at the grassroots level. Now, the primary care provider, maybe Tamil Nadu has grown, but if you see northern part, I'm traveling now, I see the nurses' role need to be really empowered. And we also here need to bring that standard. So we should be a leading set example for whole of other state in this country. With that dream, I wish once again all of you a very happy International Nurses Day. Thank you so much.